later. So you, okay, thanks, Ursula. Before our closing remarks of the GHS, Ursula and I discussed the possibility to recognize the key role that Act A has played and will continue playing in this current pandemic. For this reason, we have developed together with the Act A leadership a dedicated session within the Global Health Summit to celebrate it. President RAMAPHOSA of South Africa will open the session as co-chair of Act A. He will then be followed by a video focused on the key role of Act A. President Ramaphosa, please, the floor is yours.
Well, thank you very much, Prime Minister Draghi. And once again, I extend my greetings to all of you, Your Excellencies, and would like to thank you. Welcome to the ACT Accelerator segment of this Global Health Summit. It is indeed my privilege to be the co-chair of the Facilitation Council of the Access to COVID-19 Tools Accelerator, together with Prime Minister SOLBERG of Norway. While we have made quite good progress as the international community in battling this pandemic that engulfs the whole world, there are still substantial hurdles, including shortages of vaccines, oxygen supplies, and other life-saving interventions. The unequal distribution of vaccines, test kits, treatments, as well as personal protective equipment is widening the gulf between high and low-income countries. Since its establishment just over a year ago, the ACT Accelerator has facilitated access to diagnostics and therapeutics for COVID-19 for low and medium middle-income countries. It is the most viable global mechanism that we have that can ensure equity of access. To maintain this good work, we need to step up our collective commitment through support to Act A and financial support for that matter, for the ACT Accelerator to implement its priorities for this year. We need to urgently mobilize approximately 18.5 billion US dollars. It is in our common interest that all countries are able to vaccinate their populations as quickly as possible, and that special support is given to low and middle income countries. In this regard, we appeal to all countries to support the proposal made to the World Trade Organization for a temporary waiver of the agreement on trade-related aspects of intellectual property rights. As I said earlier, this will facilitate increased production of vaccines in emerging economies. I'd like to believe that this is the time to deepen our collaboration to ensure equitable access to medicines. This matter does not need to be overstressed. It is there for everyone to see. And I'd like to say, what we need is the will amongst all of us so that we can move forward in the spirit of solidarity and partnership, which we have demonstrated more than we've ever done in the history of the world. This is now the time to do it when we come to vaccines. I'd like to thank you for your participation also in this segment. Thank you very much.
Thank you. Thank you.
unprecedented mobilization of financing from around the globe. But we must do more. The ACT Accelerator needs $18.5 billion in 2021 to prevent further devastation in our most vulnerable countries. Using a formula that factors in national income, benefits from the resumption of trade, and income per capita, each country has been set a target contribution to ensure equitable investment alongside equitable distribution. Funding the ACT Accelerator fairly is not an act of charity. It's a global insurance policy to protect us all. The longer poorer countries go unprotected, the more the disease will spread, mutate, and threaten all countries. It's time for all high and upper middle income countries to step up by contributing their fair share. A small part of domestic stimulus packages should cover investment in the ACT Accelerator as a matter of national interest, and the 30 largest contributors can lead the way, covering almost 90% of the cost. We cannot afford not to act. This is no time for apathy or complacency. Inaction has led to millions of lives being lost already, and we have the power and the responsibility to act for the sake of our economies, ourselves, and our future. Act together. Act now to end the pandemic.
A very clear message. I'm happy now to introduce Erna Solberg, the other chair of the ACT Accelerator. Her intervention will be followed by a video by Roslyn MORAUTA, vice chair of the board of the Global Fund, and by José Manuel BARROSO, the chairman of GAVI. Erna, you have the floor.
Thank you. And as you have all seen now, there is an urgent need to increase global access to tests, to treatment and vaccines. Act A can only deliver on its mandate if it has sufficient resources. President RAMAPHOSA and I have been working hard to mobilize financial support. We need full financing of Act A to beat the pandemic. There is a funding gap of $18.5 billion. This amount may seem high, but it's small compared to the cost of inaction. We have spent much more on economic stimulus packages. Countries need to tap into their fiscal stimulus funding to contribute to Act A. There's a social investment in this, and there's a macroeconomic investment. We have developed a financial framework for how we can share the costs. A fair burden sharing system will benefit all countries. So I call on all of you to do your part and contribute your fair share to Act A. And I thank all of you who have already provided support. Norway is helping to share the burden. $500 million to Act A is a sound investment for us. In addition, we will share surplus vaccines through COVAX when possible as part of Team Europe efforts. Our current estimate is 5 million vaccine doses. Fast and fair global access is crucial, and we must all contribute funding. And we must also share vaccines, tests, and treatments. It is the right thing to do now, and it's also the smart thing to do. So let's end this crisis together now. Thank you.
I'm ready.
At the time of this critical summit, COVID-19 is on the rise globally. Many countries are experiencing emergency situations due to new waves of infections. Mutations of the virus and the alarming infection rates in many regions of the world underscore the urgent need to contain COVID-19 everywhere. The ACT Accelerator was created to provide a rapid and comprehensive response to COVID-19. To defeat the virus, we need a holistic global approach that brings together testing, treatments, vaccines, and the health systems to deliver them. Vaccines alone will not be enough. Until vaccines are made available worldwide, and as variants of the virus continue to emerge, the best strategy to fight COVID-19 is to test, trace, treat, and isolate. This requires hundreds of millions of tests, urgent oxygen support, effective new treatments, and training in PPE for healthcare and lab workers. If testing is not available in low-income countries, we're creating the perfect conditions for ever more virulent and deadly strains of COVID-19 to emerge. Since new variants can undermine the efficacy of vaccines and treatments and will inevitably spread across the world, this puts at risk even those countries that have made the most progress in vaccinating their populations. The current waves of COVID-19 hitting several countries are showing how vital life-saving treatments like oxygen are. According to the COVID-19 Oxygen Needs Tracker, over $6 billion is needed to address the daily oxygen needs in low and middle income countries. Last but not least, COVID-19 is dramatically impacting health systems and community health networks. Around 14% of COVID-19 cases reported to WHO are among health workers. Protecting frontline health workers, especially in regions badly affected by the scarcity of human resources for health, is crucial. In responding to COVID-19, we need to reach everyone, especially the most vulnerable. We can beat COVID-19 only if we act together and if all available tools are deployed and made available to all based on need. At the moment, the ACTA pillars related to diagnostics, therapeutics, and health systems are extremely underfunded. Urgent and substantive additional contributions are needed to be able to fight COVID-19 effectively by using all the tools we have at our disposal. Failure to do so will produce many more avoidable deaths and will prolong the global health and economic crisis.
As a global community, we need to understand that this pandemic is not over anywhere until it's over everywhere. Through COVAX, we have already reached 122 countries with our vaccines, but we are still very far from the around 2 billion doses that we'd like to have distributed around the end of the year. And also beyond vaccines, we need an integrated and equitable approach to support for all the tools to fight this coronavirus. Without increased funding, the virus will keep circulating, mutating, possibly originating new variants that can become more dangerous. This means more lives will be lost, more economies will be at risk. And one thing is certain, the economic cost of this pandemic is much higher than the cost of all the vaccines, diagnostics, and therapeutics. Not only the cost in human lives is unbearable, but also the global economic cost will be much higher than the necessary funding for Act A. This is a matter of justice, but it's also a matter of economic rationality. It is in this spirit that we appeal for an increase in funding for all the tools of the Act A pillars: vaccines, therapeutics, diagnostics, and health systems. In the same spirit, I am grateful that the Prime Minister of Japan will co-host with us the AMC COVAX Summit on the 2nd of June. This will be a moment for world leaders to join forces and to give a boost to COVAX, our global COVID-19 vaccine response. I count on your support. Ladies and gentlemen, in every crisis there is a defining moment. I believe that moment is now. I thank you.
Thank you. Thank you, José Manuel. Before we give the floor to Dr. Tedros, may I ask Minister ALRABIAH if he has solved his technical problems? Please.
Yes, you hear me?
Yes, I can. Okay.
Excellent. Okay, thank you. Your Excellencies, ladies and gentlemen, on behalf of His Royal Highness Crown Prince of the Kingdom of Saudi Arabia, Prince Mohammed bin Salman Al Saud, it gives me great pleasure to extend our gratitude to the Prime Minister of Italy, Mr. Mario Draghi, and the President of the European Commission, Mrs. Ursula von der Leyen, for organizing this Global Health Summit. Health is a priority, and this pandemic has highlighted its importance and its effects on all sectors and at all levels globally. As we undergo these unprecedented circumstances collectively, we are reminded daily of the precious lives lost due to COVID-19 and the exceptional individuals who fight this pandemic selflessly. Health for All has been the guiding principle behind the Kingdom of Saudi Arabia's Strategic Vision 2030 framework for health. The transformation of our health sector has been integral in the Kingdom's response to the health, economic, and social consequences of this pandemic. This, in addition to the leadership's unwavering support at the highest levels, has given us a great advantage and a handle on this pandemic. We are aware that the world still faces challenges and possibly one of the greatest health catastrophes ever experienced by humanity. We believe that through joint international cooperation and the mobilization of global health efforts, we will, God willing, be able to overcome this pandemic, as no one is safe unless all are safe from this pandemic. During the Kingdom of Saudi Arabia's G20 presidency, the custodian of the two holy mosques, King Salman ibn Abdul Aziz, called for a virtual extraordinary summit of the G20 leaders and heads of states and international organizations to coordinate global efforts to combat the pandemic and to mitigate its humanitarian, social, and economic consequences. The Kingdom maintains close and active cooperation with the World Health Organization, the European Commission, and all relevant parties involved in addressing the COVID-19 pandemic. Saudi Arabia participated in all stages of the establishment and launch of the initiative to accelerate equitable access to tools in order to combat the pandemic through the ACT Accelerator, including the COVAX facility. The Kingdom has supported the ACT Accelerator and international organizations with the amount of $500 million and has provided further assistance amounting to $750 million at the regional and international levels to address this pandemic. We also urge all countries of the world to support the ACT Accelerator, as it is the best way to combat the pandemic, and it is the main platform to support the least developed countries. And in conclusion, Saudi Arabia endorses all efforts put forth in the valuable Rome Declaration, the declaration with its principles promoting global solidarity, justice, multilateral cooperation, reliance on evidence-based policies and science, and a focus on sustainable development. Thank you.
Thank you. Okay, I just want to thank President RAMAPHOSA for his video, and thank you very much for recalling the importance of ACTA. I would also like to thank Gordon Brown, who's featuring in this video. Now, I will give the floor to Dr. Tedros for the closing remarks.
Grazie mille again, Prime Minister. Excellencies, dear colleagues and friends, first of all, I would like to thank President RAMAPHOSA and Prime Minister SOLBERG for their leadership of the ACT Accelerator Facilitation Council. And I would like to thank all of our partners in the ACT Accelerator for their collaboration over the past year. When the pandemic erupted more than a year ago, we faced a fundamental challenge. We knew that vaccines, rapid diagnostics, and therapeutics were on the way, but we knew from experience that market forces alone would leave the world's poorest and most vulnerable people behind. Today, we can prevent COVID-19 anywhere with new vaccines. We can detect it anywhere with new rapid tests. We can save lives everywhere with oxygen and dexamethasone. And we have a unique mechanism for making these life-saving tools available everywhere, the ACT Accelerator. We have demonstrated that the ACT Accelerator works. We have shipped 70 million vaccines to 125 countries and economies, as well as hundreds of millions of tests and supplies of oxygen and dexamethasone. But as we all know, vaccine nationalism, vaccine diplomacy, and severe supply constraints have left us with a yawning chasm between the world's vaccine haves and have-nots. It's not just vaccines. Low-income countries are testing at rates up to 100 times lower than in high-income countries. Many low and middle-income countries are also experiencing devastating shortages of oxygen and other essential therapeutics. The ACT Accelerator and COVAX were created to address these market failures. We now have an opportunity to fix the global imbalance. First, we need to close the $18.5 billion funding gap for the ACT Accelerator. Second, we need countries to donate vaccines immediately through COVAX, which is the agreed global mechanism for distributing vaccines. We welcome the generous announcements made today. Thank you so much. And in the coming weeks and months, we will need hundreds of millions more doses. And we need companies to help make donations happen fast by giving COVAX the first right of refusal on all uncommitted doses by 2021. Third, we must urgently and dramatically scale up production of all of these tools through voluntary licensing, sharing technology and know-how, and waiving intellectual property rights. Excellencies, we are at a critical juncture. The ACT Accelerator is a historic forward-thinking initiative based on the principles of solidarity and equity. But we have not yet achieved what we set out to achieve. We must harness the same urgency with which vaccines, tests, and treatments were developed to distribute them as far and as fast as possible. Let's finish the job we started. And finally, I would like to thank President Ursula von der Leyen for her leadership on ACT Accelerator from the start and now. I thank you. Thank you so much. Grazie mille, Prime Minister.
Grazie. Thank you. Thank you to all of you.